In this part, we will deal with cardiac action potential physiology. In previous parts, I discussed resting membrane potential concepts and many more things, including the membrane permeability to different ions, electrochemical forces, diffusion potentials, equilibrium potential, Boltzmann equation, and voltage-gated channels. I will add a link to it. In this part, we will deal mainly with the equilibrium potential. Quick recap again. What is actually the equilibrium potential? It's a highly desired state wherein the tendency of any given ion to go into the cell equals the tendency of this ion to leave the cell. For instance, sodium. There will be as many sodium ions going into the cell as leaving. We have different concentrations of ions inside the cell as compared to the outside. For instance, for sodium, 12 millimolar inside as compared to 145 millimolar outside. There's also a so-called Nernst equation for the calculation of the equilibrium potential. It states Ex, the equilibrium potential, equals 61 divided by Z, which is the charge of the ion, multiplied by the logarithm of the concentration of the ion outside, or divided by its concentration inside the cell. We can calculate the equilibrium potentials for sodium, potassium, and calcium using their corresponding concentrations inside and outside of the cell. Sodium. We calculate plus 65 millivolt. What does it actually mean? It means if the membrane permeability to sodium were very high, the resulting membrane potential would reach a value close to the equilibrium potential of sodium, which is about plus 65 millivolt. Let's say potassium. We calculate minus 90 millivolt as equilibrium potential. What does it actually mean? It means, again, if the membrane permeability to potassium were very high, the resulting membrane potential would reach a value close to the equilibrium potential of potassium, minus 90 millivolt. Calcium. We calculate plus 134 millivolt. If the membrane permeability to calcium were very high, the resulting membrane potential would reach a value close to the equilibrium potential of calcium, about 134 millivolts. Next, voltage-gated channels. I dealt with voltage-gated channels in depth in previous videos, and I will add the links. Here we have the example of voltage-gated sodium channels. Now, in principle, we could say one thing they have in common, the different types of voltage-gated ion channels. They may be either closed or open. Only they are either closed or open at different ranges of membrane potentials. In the case of this voltage-gated sodium channel, it's closed here and here at resting membrane potential of about minus 90 millivolt, and it opens up within a range of membrane potential voltages between minus 90 to plus 35 millivolt. Within this voltage range, membrane potential range, the sodium channel, the voltage-gated sodium channel, will be open. Sodium has electrochemical forces driving it inwards, so sodium starts to go through this channel. The channel closes again at voltages between plus 35 to minus 90 millivolt. Within this range of membrane potential, the sodium channels close again. Again, this mode of operation is more or less the same for the different types of voltage-gated ion channels, only that they operate at different ranges of membrane potentials. Now let's start to deal slowly but surely with the different types of action potentials. In this slide, we will deal with the differences in resting membrane potentials between pacemaker and non-pacemaker cells. In red, we have the action potential pattern in the SA node, the pacemaker cell of the heart. We can see right away there is no resting membrane potential in the SA node cells, and we will discuss the reasons in the next slide. Let's compare the resting membrane potential to the resting membrane potential in non-pacemaker cells in atria and ventricles. We can see right away very stable resting membrane potential in atria. The question is, why don't we see resting membrane potential, stable resting membrane potential in pacemaker cells? There are a number of reasons. The major reason is the presence of so-called HCN channels, also known as funny channels. I discussed them in previous videos, and I will also add the link. HCN channels, hyperpolarization activated cyclic nucleotide gated channels. They initiate depolarization of the SA node cells. Here we see the heart in action, contraction of atria and then contraction of the ventricles. This all starts off through the action of the SA node cells. We can see here the conduction system of the heart. The SA node is right here. It triggers the first impulse as action potential. This impulse is driven down the heart all the way, following a very strict hierarchy, which I discussed in previous videos in details. I will add the link also. So here we have the SA node in action. It fires. It fires action potentials. Here are the action potentials. We can see here in blue. In the SA node cells, we have so-called funny channels, the HCN channels, called funny for their peculiar behavior. For instance, they get activated at hyperpolarization, and they are not very selective to certain ions. So, at this point here, we have hyperpolarized the memory potential of SA node cells. Hyperpolarization of the memory potential opens up the HCN or funny channels. Once they open up, remember we have for sodium electrochemical forces driving it inward. Now these funny channels are permeable not only to sodium but also to potassium and probably also calcium, but mainly to sodium. At hyperpolarization of the memory potential, these HCN or funny channels open up. Sodium starts to go into the cell. It elevates the memory potential slightly up to this threshold value. And we will discuss what this means in the next slide. Here we have the action potential patterns in the SA node as compared to the action potential pattern in atria and ventricles. I would like to stress, for the different phases of the action potentials, there are numbers 4, 0, 1, 2, and 3. Phase 1 is lacking in SA node action potential patterns. Now let's get started with details. In the previous slide, we left off at phase 4, hyperpolarization. Hyperpolarization, remember, we activate the funny channels. F stands for funny. You see, hyperpolarization of the memory potential activates funny channels here and here. The funny channels are active within the range from here to here. They open up. Sodium starts to go into the cell, and it starts to slightly elevate the memory potential. With a slight delay, there's an opening of T-type calcium channels. These channels are highly selective to calcium. With a slight delay, they open up. Calcium starts to go into the cell. Why? Let's take a look at the equilibrium potential of calcium. Plus 134 millivolts. We are here around minus 60 millivolts, so there's a very large electrochemical force for calcium driving it inward. Once T-type calcium channels open up, calcium will start to go into the cell. We then reach this threshold. At this threshold, we open up L-type calcium channels, highly specific calcium channels. Again, calcium still has a very large electrochemical force driving it inward. At minus 40 millivolt or so, remember we're still far away from reaching the equilibrium potential of calcium, which is about 134 millivolt. Now, I would like to stress, these L-type calcium channels, they start to open up slightly before we reach the threshold, but most effectively at the threshold value. So this phase 0 is mediated by L-type calcium channels. They open up, calcium starts to go into the cell until we reach about 0 or 10 millivolt. Even though we still have a very large electrochemical force driving calcium inward, calcium can no longer go into the cell. Why? Because the voltage-gated calcium channels, L-type calcium channels, close at this value. At this memory potential value, they close. Calcium can no longer go into the cell. So phase 0 is followed by phase 3, which is a repolarization phase. Potassium ions start to leave the cells. There are different types of voltage-gated potassium channels opening up like a domino, one after the other. We have outward movement of potassium. Why does potassium leave the cell? Again, let's take a look at the equilibrium potential for potassium, minus 90 millivolt. At this point, we are around 0 or plus 10 millivolt, there is an outward movement tendency for potassium. This is why we have repolarization mediated by potassium ions leaving the cells. And finally, we again have hyperpolarization, phase 4, funny channels, F for funny, open up again. And this repeats itself about 70 times per minute, which is the heart rate. Now let's compare this to the action potential pattern in atria and ventricles, non-pacemaker cells. Here we have excited the cells. Phase 4 is followed by phase 0. This is mediated by highly selective sodium channels. At this value, we open up highly selective voltage-gated sodium channels, phase 0. Why does sodium like to go into the cells? Let's take a look at the equilibrium potential for sodium, plus 65 millivolt. Now, at this stage, the membrane permeability is highest to sodium. Sodium channels open up, sodium starts to go rapidly into the cells. This is phase 0, depolarization. We go up to about 20 to 30 millivolt. At this point, the voltage-gated sodium channels close, even though we still have a large electrochemical force for sodium to go into the cell. The sodium channel is closed, so sodium can no longer go into the cell. Phase 0 is followed by this dip in membrane potential. Why? At this phase, we have opening of certain potassium channels, these potassium channels. Potassium channels open up slightly, potassium will start to leave the cell. Why? Take a look again. Equilibrium potential for potassium is about minus 90 millivolt. We are here plus 20 millivolt or so. Potassium has, of course, a driving force outward. Potassium channels slide to open up at this phase. Potassium leaves the cell. This causes the dip in the membrane potential, but these channels are outweighed by the action of calcium channels, phase 2. From here all the way to here, we open up calcium channels, highly specific calcium channels. Once these calcium channels are open, they are also voltage dependent, voltage gated. During this time of about 200 milliseconds, the calcium channels remain open. We have calcium going into the cell. Why do we need this phase to be so long? We will discuss the details in the next slide. But before, let's move on to phase 3. Phase 3 is repolarization again, mediated by opening of different types of voltage-gated potassium channels, like a domino effect, one after the other, they open up until we reach again phase 4. And this too repeats itself. Now let's discuss the details concerning this phase, the plateau, for about 200 milliseconds. Why does it have to be this long, and what do we need it for? Here we see the cross-bridge cycle, which I discussed in previous parts. For the cross-bridge cycle, contraction of the cardiac muscle, we need calcium, as we see here. We need calcium for about 200 milliseconds to complete the contraction, whether in atria or in ventricles. We can see here the action potential in atria or ventricles. At this plateau phase here, we have calcium going into the cell for about 200 milliseconds. Where does calcium actually come from? There are two sources, which I also discussed in previous parts. Calcium comes mainly from the sarcoplasmic reticulum, about 70%, and about 20 to 30% from extracellular space. Calcium channels open up. So now we have an increase of the intracellular concentration of calcium, which we see here in the blue curve, following the action potential. The increase in the concentration of free calcium is answered by the contraction of the muscle. And this is why we need calcium for about 200 milliseconds. I hope this was helpful.